Hello mothers, I'm Dr. Arvind Chari from the Armed Forces Medical College. While I am a doctor, I've spent most of my career as an investor. And over the last decade, in the healthcare ecosystem, we've noticed many gaps. One of the largest of those gaps is the fact that many types of healthcare needs actually requires a full team working together as one seamless unit. And this team typically will also need to work on the basis of evidence-based protocols for the safety and efficacy of whatever treatment we're trying to give the patient. One of the areas where such care is needed the most is for pregnant women and women who have just delivered recently. As the father of a young child, I understand the need for such care. Therefore, what we've done is we've taken a look at the various kinds of needs that pregnant and postpartum women have. During pregnancy, women need to ensure that their weight gain is appropriate, as well as the fact that their pelvic floor is strong enough and flexible enough to ensure a smooth delivery, both for the comfort of the mother as well as the safety of the baby. The second thing that we need to look at is the fact that these days there is an increasing body of evidence that the nutrients that the mother consumes and the stress levels that the mother has a major role to play in fetal development. Optimal fetal development will ensure that in the long run, a woman's child will end up with appropriate neurological, metabolic, and physical development for the brightest possible future. So with the right interventions, we can ensure that the child leads as successful a life as possible. The third thing we should all look at is during pregnancy, there are the risks of certain complications such as gestational diabetes, and with the right kind of support, these complications can actually be avoided, or at least the risk of them occurring can be mitigated. And if they do occur, if these complications do occur, with the right management, we can ensure that the mother and the fetus stay healthy. After delivery, perhaps the needs go up even further. First of all, there are a host of pelvic floor complications that women undergo after delivery. Because of a weakening of the pelvic floor, a majority of women, over 60% of women, will end up with severe back pain or worse back pain throughout their lives. Women have a high chance of ending up with stress urinary incontinence, which again can be avoided with the right kind of support. And finally, there is sexual dysfunction, and there's even the risk of low grades to high grade pelvic organ prolapses. And all of this requires proper pelvic floor physiotherapy, which many countries are providing to all women today. And access and awareness of this kind of therapy in India is not all that high. The second thing is, as a parent myself, we all know that parents require pediatric support, and that too on-demand pediatric support when their neonates happen to be in the first months of their life. And feeding the child, putting the child to sleep, burping the child, several parenting needs could use with a little bit of support, and we plan to provide that. And finally, we're all empathetic to the fact that women lead very complicated and very difficult lives, and there is a lot of support that can be provided to these women so that they get back into the physical fitness levels as well as the emotional and mental state required to take on their pre-pregnancy responsibilities. Taking all of these concerns into account, what we've done is we've created a very customizable and flexible package for women, which will give them one-on-one access to physiotherapists, nutritionists, mental well-being counselors, Lamaze instructors, lactational consultants, and so on, whenever the women want to access these people. We will make sure that we are available 7 days a week so that women have that sense of safety, that there is someone out there to give them support when they need support and to answer all of the questions that may arise at whatever point. We want to make sure that pregnancy is not a lonely journey at all, that women have access to a care team that really cares about them, and also access to other women undergoing similar things to what they are, so that there's always a community that's there to support them. We will also create plenty of opportunities for women to bond with their husbands as well as other significant family members. We want to make sure that we are available flexibly day or night, and that our programs are customizable in such a way that women who are busy give us a little bit of time, whatever they can, or women who have a few more concerns can dedicate a little bit more time to us. But whatever time we are given, we'll make sure that we make as much of an impact as possible and that we integrate into women's existing lives as well as we possibly can, because we appreciate the complexities of what happens in the lives of pregnant women and women who are postpartum. Finally, everything that we do will absolutely be scientifically backed. Everything is evidence backed. We've put all our protocols through gynecologists, and in most instances, we will be working with patients in close conjunction with their gynecologists. So with that, we're very excited to launch this journey. And for all you mothers out there, welcome to the family.
So I'm Dr. Paridhi. I served 7.5 years in the army, and right now I'm on a break because I've just had a baby. See, during my first pregnancy, in the 3rd trimester, my sugar levels were a bit higher. So my doctor advised to manage through diet, which I did, but there was no supervision, there was no dietitian or anything. It was just me doing what I thought was best, and because of which it was not that well controlled. I was not on any medication, and because of this complication, once my baby was born, she had a seizure, and then she spent about 3 days, 3 nights in NICU, and that was a very harrowing experience for us. So I always thought that, you know, this could have been better managed if I had guidance from proper experts in the field. So during my 2nd pregnancy, I was anxious but cautious from day one, because of all the complications I suffered during my first pregnancy. So now this time around, I had gestational diabetes, and it had to be managed well because there could be consequences for the fetus as well as after the baby was born. So I jumped into action, and my care team provided me with the help and support I needed during that time. So I had personalized dietitian, which provided me with a fresh diet plan every 2 weeks. Then we had personalized yoga sessions and physiotherapy sessions. Along with that, mental health counselors also. So this time around, due to this much of support around me, I was able to navigate through this pregnancy without any complications, with minimal medications. And of course, the result was quite happy, and I delivered a healthy baby at full term. Counselor was the most important, most helpful to me throughout this journey, because I am by nature a very anxious person, and then you throw in a pregnancy, a 5-year-old child, and gestational diabetes, means my mind was going haywire. So she really helped me a lot throughout this journey, and throughout the labor process also, and even afterwards, because postpartum mental well-being is something that is really not much talked about. I want to tell all the mamas to be that, you know, you have so many questions, they are not invalid. You have people that can answer them well for you, and you deserve all the help that you can get during this most wonderful journey of your life.